Hello and welcome to Social Work in Older Adult Services. I'm Janine Mariscotti and I'm on the faculty of the Social Work Department at LaSalle University. Today our guest is Matthew Myrick, who is the Director of Social Services at Bryn Mawr Extended Care Center. Welcome, Matthew.
Thanks for having me, Janine.
It's great to have you here. Tell us a little bit more about yourself, please. Tell our audience. You and I know each other,
Yes.
So you don't really have to probably tell me, but tell our audience about you, please.
Okay, well, I am a graduate of LaSalle University. I got my master's at Temple University. I also received my license. For the bulk of my practice, I've been working with older adults in skilled nursing facilities, short-term and long-term care, and I'm currently, as you said, the Director of Social Services at Bryn Mawr Extended Care Center. We specialize in short-term care for older adults and also those who might have had accidents, need rehabilitation, and also long-term care for those who may not be able to function in the home or in a community setting.
Okay, so a range of services that your center offers.
Yes.
Could you talk a little bit about some of the issues that you see currently that are facing older adults, particularly in the Philadelphia area?
Absolutely. As many of our viewers may know, there's a growing number of older adults coming. The population is going to boom. Right. Just in terms of older adults, 2050, it's going to be more than ever before. And with people living longer, they need more services. In Philadelphia, we have our Area Agency on Aging, the Philadelphia Corporation on Aging, as a lot of people know, PCA, in place. But with that agency, there's so many resources and there's so many wait lists. And a lot of our clients who are older adults have to wait for those services. So a key is to basically get yourself connected as early as you can if you or your family member is an older adult and needs services from the city.
So when you say get services, get connected as soon as you can, how soon could an older adult do that? There's an age
It's an age requirement.
Right.
Usually around age 60, you should call for an assessment, an assessor to come out to meet with you or your family member to talk about your resources, what supports you have in place, and see which programs you qualify for.
Okay.
A lot of times, the clients I meet, they have no idea about PCA in Philadelphia. And so they're basically doing it as a reaction to an incident of a family member being hospitalized and needing help at home.
I see.
So the rare family member is the one who comes to the nursing home, comes to the hospital, and already has a worker in place, already has a caseload and a service plan in place through PCA.
Okay. So are older adults eligible at 60, or are they eligible at 62 or 65 for services? What is there?
A lot of times it's age 60.
It is.
It is age 60, and you just call the main number, 215-765-9000. That's the PCA helpline. And just to speak to a worker about your situation. They take basic information and set up a meeting for you to be assessed in the community in your home. Okay. And they can see how they could help you.
And can the older adult or a family member make that initial call?
Absolutely. As long as you are connected with the family member, you can make that call to the helpline. They're willing to help you and to provide guidance to you.
Okay. So I know one of the things that happens, I know just even in my own experience having parents who are aging, that there's sometimes some resistance
Yes.
to using the services through PCA. Do you have any suggestions for families about how to maybe ease that process?
As someone who went through that myself with a family member, I know it's so hard to have others invited into your home to kind of give up that control and have yourself exposed. It's very difficult to say, we can't do this alone.
Yeah.
I mean, our society a lot of times looks down on people who ask for help, like that you can't do it by yourselves. But there's strength in having more support in place. A lot of times the client, the designated consumer, as PCA would call the specific person who needs the help, is giving a lot of resistance because they're an adult. It's not the cycle of someone who's a child again.
Sure.
It's a situation where someone has lived their lives, they worked all their lives, and now they have to give up control to someone who they were the parent for.
Right.
And they have all these issues, and they want to hold on to as much as they can because they know that they're losing control. They know that their health's deteriorating, and they're facing their mortality. And a lot of times patience is the key, knowing that this is something that with patience you can conquer, you can get through, at least make it not a crisis situation, create a new normal.
Okay.
Learn to negotiate the new roles that are going to be happening with aging.
That's a challenge.
Absolutely, absolutely. And as much as everyone I've worked with in nursing facilities, we can have a professional opinion, but if it's our family member,
Right.
totally different ballgame. Absolutely.
Right. I want to ask you about another issue, a related issue that is a difficult one to talk about, the issue of elder abuse.
Yes.
And maybe you could speak a little bit about that and maybe some of the signs of that and what either a family member or an older adult who might be a victim of abuse or neglect, what they might be able to do.
A lot of times with the issue of abuse, we think primarily of only issues of someone hitting someone. You think a lot of times you hear on the news, if you heard of nursing home neglect, where they're not feeding someone or they're not taking care of them properly, they have bed sores, and we limit it to issues of verbal abuse, calling someone who's not your family member, oh honey, oh that's mama, she may not be your mother. And even though that's disrespectful to that person, if they didn't want to be called mama, don't call them mama. Don't call them baby, because they're not babies. People forget about issues of financial abuse,
Right.
Where resources, someone's check from the government that they earn is being used to support the whole family. That's an issue. People definitely forget about issues of sexual abuse with the elderly. We have these stereotypes, they're older, they're not engaging in sexual behavior. It can happen.
Right.
And another form of abuse that I've been learning more about is basically the victimization of someone's pets for an older adult. If someone had a dog who they're faithful to or a cat, and someone hurts that animal, who could be a companion, that could be detrimental and hurtful.
That's interesting. I had not heard of that.
Yeah, it's something people kind of don't think about.
Right,
a lot.
exactly. How about neglect?
Neglect's an issue where you're not doing anything. And almost inaction is an action, whether it be not helping someone, leaving them in a situation where they're at risk of harm to themselves, they don't have access to adequate nutrition, not getting to doctor's appointments. That's neglect. And that could be seen in the community and also in organized settings like the nursing facilities. The key is to report.
Okay.
Contacting your area agency on aging, which in Philadelphia is PCA. They have the helpline is the key resource if you have issues of neglect or abuse that you suspect, and let the workers come out and assess those situations.
So is it the same help, when you talked about the phone number that you offered earlier, is it the same number that people could call if they're calling for services or if they're calling because of suspected abuse or neglect?
Yes.
It is.
The 9000, the 215-765-9000 or 215-765-9040 are the two key numbers to get in contact with PCA. And there's a prompt if you want to report elder abuse or neglect.
Okay. Do you see any differences, let's say, based on gender or ethnicity among older adults in terms of those who are more open to having services or resistant, or might that just be a kind of a stereotype that we think one gender or one ethnicity would resist more than another?
As many of our viewers may know, there are more older women than men. And with that, there comes this whole issue of, like how do we appropriately service the man versus the woman? Should we be offering different modes of care because they have different expectations, different gender roles? The care should be consistent across the board, regardless of gender. And also in regards to ethnicity. Of course, some ethnicities, some cultures have a very hard time with this idea of placement. They feel like they failed their family member because if they were a very tight-knit family, it was the expectation of the family to mobilize themselves around a loved one and take care of them. It's a complete shock to the support system because they're in a place where they feel as though we failed. It's our fault because we can't do it.
Right.
And so just being aware of that and kind of, if you are working with this population or you yourself are facing this issue, think about your family story or the family story. What are they saying? Is it a situation where they're telling you, I didn't think we would ever be at this point. I promised my mom or my father we would never do this. They'll reveal to you, or you yourself might be going through this, what the conflict of your family story and this situation you might be facing.
And how does that get resolved?
In multiple ways,
Yeah.
and every family's different.
Okay.
Some situations, it ends with the loved one passing. That's the ultimate, where it ends.
Okay.
This whole system ends. And there are other situations where families come to adjust that, okay, we can't do it. This was the best decision we can make. We may not be happy putting our family member in placement or having these services in place in our home, but we needed this. We're doing the best we can for this person. Or if you yourself are an older adult and you're trying to get services for yourself, because I don't want to just say it's the family.
Sure.
You might yourself be feeling, I don't want to have someone in my home. I don't want to have to say, I can't do this.
Right.
But think about how your life would be if you didn't put those services in place. You might just be doing more harm to yourself.
And how does a family member make a decision whether to have services in the home or to move out of their home into a residential community or a continuum of care community?
It's an individualized
Also,
decision.
yeah.
There's no one size fits all. Of course, we'd love that and say, oh, in this situation, please, like, remain in the home. A lot of times it's what's available to you. If your family member is only going to get 1 hour of service and you are there the rest of the 23 hours of the day, 23 hours of the day, that might work if there's enough family to cover, like to supplement.
Okay.
Like the 1 hour is a
Right.
little extra for the family to receive respite. If you have a situation in which there's no family support and you're only going to get 1 hour or 2 hours of care, that might not be beneficial. It might be harmful for you to remain in the home
Right.
if you are not having your medication or adequate nutrition. So a lot of times it's a cost-benefit analysis, pros and cons. Am I getting the best that I can get?
Okay, right, and in the safest way possible, it also
Absolutely,
sounds like.
absolutely.
Okay. We have just a few more moments before we go to a commercial. But when we come back, I want to be sure that we talk a little bit about how services get paid for, because I think that's a concern for a lot of family members. And also a bit about the range of services. You know, you talked about different kinds of services, but what are some of those services that are available to older adults? So when we come back, I'd like to spend a few moments talking about those things.
Absolutely.
Great, thanks.
Hey, fellow TV viewers. Are you bored? Are you tired of the same old shows? Having thousands of channels to watch, but there's nothing there? Tired of sitting by yourself on your old mama's striped couch? Sitting in your room by yourself, watching someone who resembles your grandfather? Yeah, I know. I used to be just like you. By now, all hope is lost. You're flipping through channels, wondering what to watch. Boring. Boring, 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 boring. Wait, what's this? LaSalle TV. It's new, it's bold, it's great. It's not your ordinary TV.
Hello, welcome back to Social Work in Older Adult Services. I'm Janine Mariscotti from the Department of Social Work at LaSalle University, and my guest today is Matthew Myrick. He's the Director of Social Services at Bryn Mawr Extended Care Center. We've been talking right before the break, Matthew, about different ways that individual older adults or family members could access services.
Yes.
And we talked a little bit about the issue of elder abuse and neglect. I wanted to get back to the issue of services and how they are funded, because I know that it's also a concern among a lot of older adults who might need the services but are really fearful about finances as they're aging.
Yes. And a lot of times the name of the game is what you have. In terms of private pay, if you could privately pay for all these services, go for it. There are agencies that are willing to help you provide things to you if you have an abundance of resources available to you. Unfortunately, that's not the situation for a lot of people. So for many older adults, they may have Medicare or Medicaid in the community. Or they might have their private insurance. Those three avenues, I should say, are the ways that these programs, these services are covered.
Okay.
A lot of times when you go through intake, whether it be through PCA, whether you go through an admissions process at a community, whether it be a nursing home, assisted living, they do almost like an assessment with you to see what your resources are, and they're going to tell you what they can tap into to cover the services. You as a consumer, whether you be yourself trying to get placed or get services, or a family system doing this, you want to have that full conversation with the business office, with the admissions department, with the intake worker. What is going to cover this bill? What's going to cover this or basically allow me to access these services?
Right.
If you have Medicaid in the community, that will translate into nursing home facilities that do accept Medicaid as a form of payment. So that's
Would
something
you
to be aware of.
clarify the difference for our audience, our viewers, between Medicaid and Medicare?
Absolutely. And this is a thing that a lot of people get caught up on. Medicare is an entitlement program. When you turn a certain age, or if you're disabled for 2+ years, you can automatically apply for it and receive it. Medicaid is means tested, meaning it's based on the resources you have, the income you have. Some children have Medicaid. People who are disabled and younger have Medicaid in the community. And so basically, you want to, if you don't have these services, apply for them. You want to tap into them as soon as possible. Of course, some people still keep their private insurance from when they were working, and that may be a way to pay for services, but not always. So you just want to do your homework in terms of asking your member services, contacting them, what is covered, and then also speaking with staff, whether it be with the service agency or in the community setting that you're interested in transitioning to.
Okay, great, thanks. So when we talk about services, what are we talking about? So what are the range of services that might be available to older adults in the home and, if they choose or need to move out of the home?
So let's start within the home first. It can range from a meals program, Meals on Wheels, where someone's delivering you a meal throughout the week consistently so that you can just put something in the microwave, don't have to worry about mastering your kitchen appliances and at risk of possibly burning something, forgetting something on the stove. The meals comes to you. Another program is an aide visiting you in the home, whether they're doing ADLs, which are activities of daily living, helping you with bathing, washing, dressing, whether it be services that someone helps you organize your home. Then it could be services of a nursing nature, where someone's coming out and they're doing medical things with you. Other services that are available to people in the home are physical therapy, occupational therapy, speech therapy, social work services. So those are some of,
yeah.
and then a lot of times with PCA in Philadelphia, you're assigned an hours of service. Now, how those hours of service are divided up, whether it's going to be a CNA caretaker, or whether it's going to be a social worker, what have you, caseworker, varies.
Okay.
In the nursing facility, and of course there are different levels. You have assisted livings, which, more independent, structured living, nursing homes, skilled nursing facilities. You're gonna have a more structured environment where staff is there around the clock. And you just wanna always, again, do your homework with the agency, especially if you're thinking about a more independent living situation, about how many hours is someone available to you. Is it 24 hours? Is it that someone visits, 3 shifts to give medication management?
I see.
Because it could vary.
Okay.
In my world, in the nursing home, 24-hour care nursing, someone's always there.
Right.
Assisted living, it might be a situation where you have your own apartment, and there's a call bell for you to access, for someone to call, and if you need the help, if you
Right.
can master a call bell, someone will come. But they're not watching you 24/7
Right.
in terms of, we're right there, where are you, you have a little more freedom.
Right. That's a really important distinction, because I think a lot of times people don't recognize the difference between assisted living and nursing home.
Yes.
And it really is an important distinction. I appreciate you making that. Let's talk a little bit about social work.
Okay.
And what opportunities there are for social workers working with older adults.
Well, currently there is that resistance to working with older adults. Even though the need is there, the population is booming, there is such resistance. And a lot of times that's because those in the social work field may not think it's the most glamorous work. They also have to face their own issues of mortality working with older adults and seeing people who are sick. If you're not comfortable seeing individuals sick, dealing with
right.
death and dying issues, this might not be the field for you. You really have to confront yourself and maybe family feelings, maybe a family member who passed, a friend who was older. What is your feeling on that? But there's so much hope and resilience in older adults. There's so much room for change. I think we stereotype older adults as rigid, fixed, unchanging, but these are individuals we can learn from who have a unique story.
Yeah.
And we just have to be willing to hear their stories and try to connect them to services. Because a lot of times you think about the technology changing and all these things they have to maneuver through. And if they don't have good advocates in place, they're just going to fall through the
Right.
cracks. We need advocates for them. We need people who are going to sit at the table for them.
And are there opportunities for social workers with their bachelor degree as well as master's degree, or do you think you have to have them? And a lot of times you'll hear the social worker has to have a master's degree. How about with working with older adults?
Both, in terms of working in a nursing facility, you can have your bachelor's degree and do that. However, some nursing facilities, and especially hospital settings, where you have a lot of access to older adults, they require you to have master's and probably your license. And some nursing facilities are biased. They want someone who has their master's and who can have that clinical background, that direct care knowledge,
Right.
that focus in mental health, to deal with the variety of issues you face. A lot of people think little stereotypical old woman in the nursing home. Issues that someone had in the community that they might have had their whole lives are presenting themselves in the nursing home. Drugs and alcohol,
Right.
mental health issues, dual diagnosis, they're there.
Right, they're not going away
They're not
just because
going
we're
away.
getting older.
Yes, they're still in place.
Right.
And you have to be prepared to work with them with the resources you have.
So talk with us a little bit about LaSalle's social work program. You wear a few different hats, or have worn a few different hats.
Yes.
Graduate of the program,
Yes.
and now, as you mentioned, have taught in our program for us as well, and have also supervised students at your agency. So you've had a lot of experience with, particularly in our case, BSW students.
Yes. So it's been, I would just say, a very humbling experience to go from a student in the classroom learning about older adults, interning with older adults, and now I'm passing on that knowledge that I have to interns, and also in the classroom setting with
Right.
students. That's my practice experience. And even with my students, they themselves are surprised about what's happening in the nursing facility with the older adults. But it's needed. And I think there's, again, such opportunities for growth. if you choose to go into this field of practice. I think our students, especially here at LaSalle, working in urban areas, having a vast variety of backgrounds, diversity, experiences, are ready to deal with what they're going to be facing in the nursing facility with older adults. Again, as you said, the issues are not going away because
Right.
someone's getting older.
Right.
They're just being transferred to a different place, and they're also happening with someone who's aging and getting older.
Yeah. So I know you're very biased,
Yes.
but why would you, somebody in the community is thinking, maybe I'll go back for a social work degree. I think I do want to work with older adults. Why would you recommend, well, let me assume you'll recommend LaSalle.
Okay, yes, I do recommend LaSalle.
Why?
I think we have something really unique here. We focus on the bio, psycho, social, spiritual perspective. A lot of programs don't do that. They limit that. And I think we embrace it in the urban area. And that's not to say, even though we are a Catholic university here at LaSalle, we are not just exclusionary. We want to hear about spirituality takes on many different forms, and we want to celebrate that. And I think that aspect walks hand in hand with end-of-life, older adult issues who are facing mortality and might be ready to talk about that. Someone who may never had a faith base might now be ready to have that conversation with someone.
Okay. That's great. Thank you.
No problem.
I really appreciate you being here and talking with us today about this very important topic.
Thanks for having
This
me.
is social work in older adult services. We are making a difference. Thank you.